So we're here to talk about our new book that we're very excited about, the Medication Fact Book for Psychiatric Practice. And as you may know, I'm Daniel Carlat. I'm the editor-in-chief of the Carlat Psychiatry Report. And I want to introduce our co-author. Actually, she's the first author. I'm the second author. So the first author of the book is Talia Puzantian. Talia?
Hi, everyone. I'm Talia Puzantian. I'm a PharmD and a BCPP, which is a board-certified psychiatric pharmacist. I'm currently working as an associate professor at the Keck Graduate Institute here in Claremont, California. And I'm just really happy to have this new book, this new edition out.
Yeah, I think it's a good book. And, my mission, our mission in Carlat Publishing, and my personal mission, I think, has been to create information for subscribers that's very practical, but also information for me. I think I began writing these fact sheets over 10 years ago, 10, 12 years ago. And my idea with them was always, let's create something that can fit on one page, because it's just nice to open up the book and, you're looking for whatever, Zyprexa, and you see it all on one page. And even though I use things like Hippocrates and other apps, I find that you still have to kind of scroll through to get information. It's just nice, and it's kind of tangible. It's nice to have paper sometimes. So I think it works out pretty well for people. I think people are liking it. Maybe we can give a little guided tour. Talia, we were talking about what medication we wanted to talk about, maybe Latuda, because that's kind of a more recent entry in the antipsychotic field, pretty heavily hyped. So why don't you go through, kind of go through the sheet, and we can talk about some of the features of the fact sheets.
Right, yeah. Well, the new edition, we added a total of 24 new fact sheets compared to the second edition. And many of those were some new medications, and some were older medications. There are now over 101 fact sheets, and this is what the fact sheets look like. We cover kind of the information that clinicians want to know at their fingertips right away. What are the indications? What are off-label uses that are, fairly well supported by the evidence? And so those are the ones we chose to include there. Dosage forms that are available, dosing guidelines, and we didn't just take the package insert dosing information there. We really used a combination of that along with what's really better informed after more time in clinical practice and some time using it. And we also included cost information there, because sometimes, even though a lot of our patients have coverage with insurance, we wanted to include the cost information and just to have some sort of relative idea of how expensive a medication is. And that also reminds me, this Latuda doesn't have a generic, but the medications that do have a generic, we included that on the fact sheet as well. And sometimes that's an important piece of information to know when you're looking up medications with a patient in mind. And then we have the side effects. And again, these are sort of better informed on our clinical experience as well as the evidence base. And we've added mechanism of action, which we didn't have before, some basic pharmacokinetic and drug interaction information, some clinical pearls. What are the things that you can think about when you think about this particular medication? And we always end with a fun fact and the bottom line, which is often really where the clinicians will go to when they're not looking for something specific. But what is it? What's the gist? What do I need to know about this medication?
Right. And, so for Latuda, we talk about how it has some unique receptor features, although it's shown no clear benefit over other atypicals on measures of memory, cognition, anxiety, pain. These one-page fact sheets are helpful, I think, for clinicians, definitely helpful for me as I'm seeing patients. And then the other thing to go to is at the beginning of every section, we have a more comprehensive table. So, for example, for the antipsychotic section, if you go to page 44, there's a nice, in this case, 2-page long table of the atypical antipsychotics. So I like this because, you're sitting with a patient, you're thinking, well, I want to maybe add a certain atypical to their regimen. Maybe you're treating OCD, treatment-resistant OCD, or treatment-resistant depression, and there's just a ton of new medications that have come out over the recent years, and you can just kind of go right through this chart on the left side, looking down at all the different meds available, and then if you practice based on relevant FDA indications, which is maybe a more cautious way of practicing. I don't always do that. I mean, I'll go off label often, but it's nice to know what the actual indications are, and it's just the tables provide a very quick referencey way of getting that information.
We have a couple of new chapters. One is on anxiety disorders, so we created a new chapter for anxiety meds, and we created a new chapter on sleep meds. So we have modafinil and armodafinil, and we have Xyrem, sodium oxybate in there, and we added a couple of new appendices as well. One having to do with controlled substances and how those are scheduled by the DEA. And I think one that's going to be really useful for the clinician, which is lab monitoring of medications. And
yeah, absolutely. I remember we did actually an issue of the Carlat Psychiatry report based on lab monitoring. And I thought, the table that we created for that newsletter has to make it into this book. So we sort of said, hold the presses, let's add that as an appendix. So you can go to the very end of the book, and if you're just not sure whether you need to really be monitoring something or not before you start something, there's just a quick reference table.
Danny, I think what I thought of this when you and I were first talking about this type of book and doing another edition of it is, as a psychiatric pharmacist, I've worked in various clinical practice settings with psychiatrists and other mental health clinicians, and my role is really just providing medication information. And so this book, I conceived of it as a way for the practicing clinician to be able to find the information that I would get asked fairly frequently, and they would very quickly have access to this. So I love the concept of your fact sheets, and it's a very well organized and a quick reference, and these appendices also serve to answer a lot of common questions too, in terms of pregnancy and drug interactions as well.
And now I'm talking to you, the prospective readers, or maybe you've already ordered a copy, maybe you already have a copy, really want your feedback. We will be, the last time we did this was 2014, so it looks like we're going to maybe do it every couple of years. So we want your feedback in terms of what you like, what you don't like, what you'd like to see added to these. We also want you to know that we're going to be doing online updates so that you don't have to worry about missing out on new information. Every couple of weeks or month or so, we're going to put on a dedicated webpage any new information about new dosages, new FDA indications. If there's a new medication that's approved, we're going to quickly make a fact sheet. Talia will probably do it more quickly than I would be able to do it, but she will quickly make a fact sheet, and we'll throw it up on that webpage. Another nice thing, I mean, you can read, you can just purchase the book as a reference book for your practice, or you can also take advantage of the CME credit. And so you can get 8 regular CME credits, and there's an online 100-question multiple choice quiz that you can fill out. And then for those of you that need the kind of super duper self-assessment CME credit, you can also combine this book with our bigger self-assessment course, which combines it with a 1-year subscription to the Carlat Psychiatry report.
Thanks, Danny, and everyone else for tuning in. It was a great project to work on. I think we've put together a really great resource, and it's been great to hear from clinicians who've already gotten some good use out of it. And I look forward to getting some updates going until the next edition.
All right. Well, thanks for joining us. If you want any more information, go to our website, www.thecarlatreport.com, and enjoy a lot of the free information we have there. If you're not a subscriber, and if you want to subscribe to the newsletters, there's that, and then there's the medication fact book, and we also have a drug metabolism and psychiatry book that a lot of people like. So again, thanks so much for joining us, and hope to see you again soon.